Good afternoon, all. I'm Erie County Executive Mark Poloncarz coming from the Rath Building for you today to give an update on COVID-19 as well as the protests and issues that we had over the last few nights. I'm joined by Dr. Gail Burstein from our Department of Health and Kendra from Deaf Access Services, our newest celebrity after her recent little story about her and the good work that she and the other American Sign Language representatives are doing. Before we go into the COVID-19 numbers, I wanted to talk a little bit about incidences of the last few nights and where we are today. We did have a curfew last night, and as I think everyone knows, there were some smaller incidences, but we did not have major incidences. And as best as I know, there were 3 incidences in the suburbs of break-ins at Target, one in Cheektowaga at Lawson and Transit, another one in Amherst on Transit, and then a third in Orchard Park in which they actually arrested the suspects. It was a coordinated effort for all 3. Orchard Park Police has more information. There were individuals who were under the age of 18, so they will be treated as children. The vast majority of incidences that existed yesterday were very small. There were a number of arrests that were made as a result of the curfew, and those were announced by Mayor Brown last night, but generally last night was a very quiet night. I do not intend to implement a curfew tonight. So if people are wondering what the status of the curfews are, they are ended. We had a good night last night. I'm hopeful that that continues. We know there'll be an increased police presence on the streets no matter what. And there is a protest that's scheduled in downtown Buffalo to start at approximately 3 p.m. I'm hopeful it is a peaceful protest. As I've talked about for the last few days, we are all disgusted by what we saw in Minneapolis with the death of George Floyd at the hands of a police officer and 3 other officers who did nothing, it seems like, other than to hold him down. Knowing members of law enforcement, the vast majority of those, 99.999%, are good individuals who are there to serve and protect. And they are disgusted as well as what they saw in Minneapolis. And we're also disappointed and disgusted to see the violence that is going across our country right now. While we had a very violent evening 2 nights ago in Buffalo, we did not have a violent evening to really a full extent as to what we were worried about or what was being seen in other parts of the country. And I think that has a lot to do with our community standing up and saying we're not going to be defined by the violence, we're going to be defined by the individuals who helped clean up the mess that had resulted after Saturday night's incidents in Buffalo. And I think that's really what the spirit of this region is, the city of good neighbors, a county of good neighbors, as we come together to stand up to violence in all its forms, to talk about how we need to solve the issues of racial injustice. I thought about coming up with some really interesting quote, but then again, I don't really have the experiences of an African-American male or female, and I never can. And it really, as having lived a life that I have as a white male, I'm not going to understand the issues that an African-American will deal with. But I thought it was very important that we talked about the issues of racial injustice and how to best deal with it through nonviolence. And that's why I want you to hear the words or see the words of someone who knew about violence, who understood about violence, and unfortunately whose life was taken from us far too soon by a violent measure. And that's Dr. Martin Luther King, Jr. So if you may, I'd like to read you a passage from his speech when he accepted the Nobel Peace Prize in 1964. Violence as a way of achieving racial justice is both impractical and immoral. I am not unmindful of the fact that violence often brings about momentary results. Nations have frequently won their independence in battle, but in spite of temporary victories, violence never brings permanent peace. It solves no social problem. It merely creates new and more complicated ones. Violence is impractical because it is a descending spiral ending in destruction for all. It is immoral because it seeks to humiliate the opponent rather than win his understanding. It seeks to annihilate rather than convert. Violence is immoral because it thrives on hatred rather than love. It destroys community and makes brotherhood impossible. It leaves society in monologue rather than dialogue. Violence ends up defeating itself. It creates bitterness in the survivors and brutality in the destroyers. In a real sense, nonviolence seeks to redeem the spiritual and moral lag that I spoke of earlier as the chief dilemma of modern man. It seeks to secure moral ends through moral means. Nonviolence is a powerful and just weapon. Indeed, it is a weapon unique in history. which cuts without wounding and ennobles the man who wields it. I believe in this method because I think it is the only way to reestablish a broken community. It is the method which seeks to implement the just law by appealing to the conscience of the great decent majority who through blindness, fear, pride, and irrationality have allowed their consciences to sleep. Those are the words of Dr. Martin Luther King from 1964, and I think they fit exactly to where we are today. Except I believe the vast majority of our nation's consciousness are not sleeping anymore. They're standing up to the racial injustice that they've seen across this country. They want to say no more to police brutality, and I think it is very important that you are seeing the vast majority of people of this country saying peacefully, we need to change this. And that's what we need, are peaceful protests. So to those that are going to protest later today, whether it's in Buffalo or elsewhere, please be peaceful. Follow the words of Dr. Martin Luther King Jr., and we will be a better, more just society for it. Now I'd like to move on to the issues associated with COVID-19. And as always, we have our little proviso that the information that we're providing you today is as accurate as was put into the PowerPoint presentation, and it may have changed at any moment and often does. We have received new information today on case counts. We have not yet received new information on mortality counts, and we'll probably have those a little later today. But as of June 1st, as of this morning, 6,065 people had tested positive since the beginning of the crisis in Erie County out of 60,633 tested. 524 have died. Those were all confirmed cases at the time of their death. They were confirmed when they were alive. We do not do presumed positive cases in Erie County. As of May 30th, we had 125 individuals in hospitals for COVID-19. It's the lowest amount we've had in quite some time. 29 of those individuals were in the ICU unit, and 16 had an airway assist. And as you can see from the graph on TV right now, that trend number with regards to patients keeps going down. The numbers associated with ICU and ICU assists have basically stayed static for the last week or so. One good factor in the last few days in hospitals, we've seen the least amount of deaths in most recent time. There were no individuals who died in hospitals on May 30th. There was one on the 29th, and there were 2 on the 28th. This, of course, is very important because we have a 3-day rolling metric we have to keep, which is less than 5 on average. We are definitely meeting that, and that's why, with regards to the decreased hospitalizations, we're in a much better position. Now, the admissions versus discharge chart, this has often had a 1 or 2 day lag from the numbers that you see on this chart to the final hospitalizations, but there was a really weird period where we couldn't figure out what was going on between May 24th and May 27th, and you see all those tall blue bars. We believe, based on conversations that we've had with representatives from hospitals, that there were individuals who were included during those days that came to the emergency departments of hospitals that were COVID-19, but they were determined not to be in such a state that they needed to be admitted. So they were listed on the hospital's charts with regards to COVID-19 patients in that day that they treated, but they actually were not admitted. So that explains why we've had some discrepancies in the recent past when we were seeing our hospitalization numbers go down, but not these admission numbers. It really made no sense. We're going to keep on looking at these numbers because we think it's important, but if we see a discrepancy like that, we're going to look into it further to figure out why that is the case. But most importantly, we want to see those hospitalization numbers drop. You see the same thing with regards to hospitalizations in Western New York. They continue to drop. That's very important. It sets us up for reopening tomorrow, as the governor said. It looks like we'll be reopening tomorrow. We're going to get final word on that later this afternoon, but the numbers have been really good for a phase 2 reopening tomorrow, which I think we're all looking for. I'll turn it over to Dr. Burstein to talk a little bit more about some of the statistics with regards to the deaths, as well as caseloads, and what we've been seeing most recently, which is declining percentage of individuals testing positive. So, Dr. Burstein?
Sure, thank you. So this graph is looking at COVID-19 cases diagnosed among Erie County residents by age on the x-axis, and where females are in yellow and males are in blue since we started. So you can see that pretty much any adult age, people 20 and up, are at risk of COVID-19. They're getting identified. People ask, well, why aren't we seeing many people identified under the age of 20? I think part of that is, remember, this is surveillance data, so it's really, we don't have a positive test unless somebody gets tested. And we know that fortunately with young people, they're more likely to be asymptomatic or have minimum symptoms, even though they may be infected and they don't come to testing. We have seen a post-inflammatory response among some young people, unfortunately, in New York State and in the rest of the United States. We had 3 suspected cases here earlier this spring that fortunately did not confirm in. However, we know that we believe that more young people are not being tested in general because they're asymptomatic. However, it doesn't mean that they're not infected and we're not detecting it. But so the bottom line is anybody is at risk. Next, please. So as our county executive alluded to, we are seeing overall, over time, more testing done and a smaller proportion of people who are tested who are found to be infected with COVID-19. So these data are looking at our COVID-19 diagnostic tests in the total bars over time. So starting from March 21st on the x-axis and then going to the end of the x-axis of May, the week ending of May 30th. And so you can see that, again, this trend over time with an increasing number of tests being done per week, whereas this past week we had a little over 1,400 tests done for the whole week, and unfortunately only about 6% of those were positive. So that's the direction we want to keep heading. And it's not because COVID-19 is going away, it's because we're being smart with our behaviors and decreasing that chain of transmission by social distancing, and then if we're not able to social distancing, wearing masks, staying outdoors, and washing your hands. Next, please.
Will, I think you said 1,400 tests. We actually did 14,000 tests.
You're right. Wrong zero. Sorry. 14,000. Woo! Okay, and then here we're looking at our antibody tests from when we started looking at this at the end of April through the last week that ended on May 30th. And so you can see we're seeing an increased number cumulatively so far. More than 47,000 Erie County residents have been tested for antibodies. And of those, 7.5% have been positive. You can see there's also it's just a small trend of a smaller proportion of people who are tested that are positive. So that lets us know that there's still a lot of people that are vulnerable to getting infected with COVID-19 in Erie County. Again, we don't know the type of protective immunity that having antibodies imparts. However, so we don't know it'll protect us from a recurrent infection. However, we're hoping that it'll give us something, and we don't know for how long, but we just do know the bottom line is there's still a lot of people out there that could be infected with COVID-19 in the future. Next, please. So these are looking at our mortality data among Erie County residents who had died of COVID-19 through June 1st. And so you can see the age groups are along the x-axis, and gender, where females are in yellow and males are in blue. And so you can see it's very obvious that the majority of, unfortunately, our victims of COVID-19 that we're very sad to lose are our seniors, so people the ages of 60 and up, especially people in their 80s and up. So it means we have to be very, very protective of that age group, helping them out, making sure they don't have to go outside, don't have to get in contact with anybody, and doing whatever we can to keep them healthy and safe. Next, please. So these are looking at our mortality data a different way by looking at where people live. So you can see that in the first column is looking at the different residences that we're looking at, either Buffalo or Erie County outside of Buffalo or total. The next column is looking at the number of fatalities by residents. The next column is looking at the proportion of fatalities by residents, and then comparing that to the total population. So you can see that the proportion of our COVID-19 victims are very proportion to very similar to the proportion of where Erie County residents live. So again, the take-home message is that there is nowhere that is safe. That anybody, especially who are seniors, are at risk of becoming very sick and dying of COVID-19.
If I could add, the one thing that this slide, and we showed it last week, revealed is there's a number of individuals in the community who were saying that the city of Buffalo was being disproportionately hit in deaths based on the population, and there was no data for that locally. We don't want anyone to die regardless of where they come from, whether they're in the city or the suburbs or the rural area. But while there are areas of the country where the vast majority of the deaths in a community are coming from an urban environment, a city environment, much higher than they should based on the population density of that region, is not the case here. And so for those that are out there saying there has been an undue number of deaths in the city of Buffalo based on the population compared to the rest of the population of Erie County, that just is not accurate. And it goes to show the great work that we've done as a community between ourselves, our partners in the healthcare industry, the African American Health Disparity Task Force, and others to ensure that we got appropriate treatment to individuals who are sick, but more importantly, testing of individuals so that we were able to ensure if they were positive for COVID-19, we were able to get them early enough so that their illness did not have a much more detrimental impact, including death.
Thanks, Mark. So again, here we're looking at our COVID-19 mortality data, looking at by race, ethnicity. Again, the first column is looking at the different races and ethnicities. The second column is looking at the number of fatalities by ethnicity and race. The third column is looking at the proportion of those, and then the last column is looking at the proportion of Erie County residents of among each race and ethnicity. And so again, you can see that in Erie County, the proportion of people who have died of COVID-19 by race is very similar to the proportion, according to our census data, of Erie County residents by race. So again, it's affecting everybody. You can see that in terms of ethnicity, there's a little bit of a disparity there, where a lower proportion of individuals who've succumbed to COVID-19 are identified as a Hispanic Latino compared to the proportion of an Erie County population. We're not really sure why that is. It may be a data collection issue where the right marks aren't being checked on the form where they collect those data. And the registration for the tests. So we're not sure, but however, I think the bottom line is that everybody is at risk of COVID-19. So, Erie County responds. So next we're going to talk about the testing that's being offered in our community. So first of all, the Erie County Health Department is offering the diagnostic testing. So that will tell you at the point of time when you had your specimen collection, and here it's a nose swab, if you had active infection with COVID-19, if we were able to detect a virus. So in order to get that test, you have to call 858-2929. We do have foreign language interpretation available, so language is not a barrier for this test. And so we really want to test anybody who think that they could have been at risk to COVID-19, people that have symptoms, people that are known close contacts, people who work in an environment where they have to interface with the community and they're worried that they could be in close contact. And now we know that our people working in hair salons and barbershops are required to get tested every 2 weeks. So they don't panic. You don't have to get a test to open up. However, while you are open, the New York State is recommending that people do get a test every 2 weeks. So the Erie County Health Department and other sites are able to do this testing for you. We're able to do it if you don't have insurance and if you don't have a physician's order for it. It is still by appointment only, so we do need you to call. And we are opening up clinics throughout Erie County. We're doing this 3 days a week, Monday, Wednesday, and Friday, and each day of the week we're at a different location, so hopefully we'll be at a place near you. So we're just please asking, so the demand of swabs is going up, these diagnostic testing is going up. We're asking that people make an appointment, please show up to your appointment because you're taking the spot of somebody else who really could use that test. Next, please. So we're also doing antibody testing now. Right now we are scheduling for June dates for this week and I think part of next week. So again, we're going to be all parts of Erie County, and you just have to call 858-2929 to set up your appointment. You don't require any type of insurance. I know some insurances won't cover this, so because it's not a diagnostic test, but this is again supported by the Erie County Health Department, and you don't need any type of physician's orders. So it does require you to have blood and give us some blood from your arm, but it's very quick. It's a very quick process. You'll be in and out probably within 5 to 10 minutes. So it's a very quick process. We are rotating through sites through Erie County. We're doing clinics on Tuesdays, Thursdays, and Saturdays. So right now we have clinics scheduled in the city of Buffalo, Orchard Park, Springville, and Williamsville. And again, we're asking if you made an appointment, please show up, because you could be taking a spot of somebody else who really wanted that antibody test. So if you're wondering, well, where else could I get tested? Maybe these sites don't work for you. So we have a really handy-dandy tool for our Erie County residents. It is an interactive map on our website. It's www.erie.gov/COVID test sites. And so you can look at this map and see where there is a testing site nearest you. So this gives information about diagnostic testing with the swabs. It gives information about antibody testing and hours of operation. We also have in there information about the pharmacies that are offering these testing, because more pharmacies are coming on board now. So what you do is you figure out where you live, click on one of these purple stars, and there'll be a little pop-up window that'll give you all the information about that testing site. So there's lots of testing sites in the community, as you see, so we really want you to take advantage of that to see the site that's closest to you that fits your needs. Next, please. So I'm going to turn it over to Mark to talk about phase 1 of opening.
Thank you, Dr. Burstein. We are in phase 1, and if things go well, we'll be in phase 2 tomorrow. Though I don't have the definitive answer. The governor said we would look like we were going to do that. I'm waiting for the final numbers today. So phase 1, of course, is open, which I think we all know about. It's been open for 2 weeks. Construction, agriculture, forestry, retail, limited to curbside pickup, manufacturing, wholesale trade, but very close, I think, very close, is phase 2. If you are a business that is included in the phase 2 industries, you have to file an attestation with New York State that you have a safety plan in place. You do not need to put the safety plan, provide it to New York State or Erie County, but you do need to have one in place. It has to be available for your employees to view, or others such as patrons. And you can get guidance on what is needed at the site that you see on the screen, which is forward.ny.gov/phase, and a little line there, 2, and then industries. So you need to go to this website. You need to download the template that's available so that you can have a safety plan in place, and then you need to do the attestation with New York State before you can open. And that includes professional services like law firms, accounting firms. We know dentists can open now. Retail can have can have a less capacity, but they can open up so that you can have people walk in and purchase in store now. Administrative support, real estate, rental and leasing, and then barbers and salons. And then they announced the guidance for barbers and salons last week, one of which was in particular, barbers and beauticians must have a face shield available. They have to wear masks at all times, but while they're cutting hair, they have to have a face shield on. And we've heard from our constituents that they're not certain they know where they can get face shields. So we are providing to every barber and beautician in Erie County one face shield, if they so choose, a reusable one, as well as other PPE. And it is available, but you have to fill out a form on our website, and it is available, the form, at www.erie.gov/face shields to register. The locations for pickup will be provided to those who register. An owner of a business that has, let's say, 10 stylists can apply for the face shields for each of the stylists. and that is available on the website. So we want barbers and beauticians to take advantage of this. We also, as the doctor talked about, are offering COVID-19 diagnostic testing. Barbers and beauticians do not have to have a COVID-19 test before they start, but they have to have one within the first 2 weeks. The assumption is if you are not showing the symptoms, you probably do not have it, especially based on the numbers we have. But then when you start dealing with the members of the public and what was seen elsewhere, including a barber in, I think, Dutchess County, who actually was doing it illegally in his house and then spread COVID-19 to others, we want to ensure that the barbers and beauticians stylists don't have that. So Erie County will be offering free diagnostic testing. You have to register, of course, call at 858-2929. You have to do that once every 2 weeks. You will get a written response from Erie County on the results of your test, so if you have a negative test, you can have proof of it. But for those that are interested in face shields and other PPE, go to this website, fill out the form. Our Department of Emergency Services will get back in touch with you with the dates and locations of distributions, with the first date actually being tomorrow. So those who register early potentially could get face shields and other PPE tomorrow. But we wanted to make that service available, and this is free to the public. There's no charge to the general public for this. And I mean general public, I'm talking about barbers and beauticians. We don't want the general public just to request face shields. We only have a certain supply of them. We do have a listing from New York State of the licensed barbers and stylists, and we will cross-reference that to make certain that these individuals who are receiving them are actually licensed. With that, we will open it up to questions and answers with regards to the issues of COVID-19 or the protests in response to the murder of George Floyd and what otherwise was also looting and rioting in our community. So let me turn on the volume here so we can hear our friends from media. And we will start at the top. Anybody call in from AP? B News? Anybody from B News? Buffalo Business First? If not, the Buffalo News. I know we have Aaron Bessaker and Sandy Tan. Remember to...
Hi, Mark. In regard to the face shields that you're making available to beauticians and barbers as well as other PPE, what does that other PPE include? Are you talking about gloves and face masks?
Sanitizer and face masks. We do not have enough gloves to provide at this point, but we are providing sanitizer if requested, and there would be a small supply of face masks that would be provided, though it seems like a lot of people can get access to face masks.
Okay, thanks.
Mm-hmm. Aaron, did you have a question?
Sure. Can I ask about, you mentioned the 3 incidents at some suburban Target stores. And I believe you said they appear to be coordinated. Do you have any more information about that?
They appear to be the same individuals, and that were basically going from one Target to the next, broke into a Target, escaped before police came. They started in Cheektowaga. The news went out to local law enforcement that there was a break-in at Target. Be wary. They seem to have just escaped in Amherst, and then were caught in Orchard Park. And it's my understanding they admitted to having perpetrated the crimes in both Cheektowaga and Amherst. And I don't have all the data on the locations of the individuals, though I know one of the individuals was from the town of West Seneca. So it's not as if there were individuals. I can't talk about all the individuals, but I don't want people to think that these were just individuals coming from the city of Buffalo to prey on those in the suburbs, because I know at least one of the individuals was from the town of West Seneca. Okay, we will move on. Anybody from Investigative Post? I think we have Aaron from Spectrum News.
Yeah, hi, Mark. I wanted to know if you and Dr. Burstein are concerned that there will be an increase in cases after this weekend's protests and mass gatherings. And if so, when can we expect to see those numbers show up?
Well, my answer would be yes, but I'll turn it over to the doctor to answer more.
Well, of course I'm going to agree with my boss. So, but yeah, I truly am concerned with increased number of cases that we're going to be seeing in our community as a result of failure to social distance and mask during these protests. We know that we know what happens with COVID-19 transmission. We know that how you get infected, and so we're just hoping that somebody in the group did not have an infection that they weren't aware about and transmit this to other people. But time will tell. The incubation period for COVID-19 is up to 14 days. And some people never develop symptoms, so that's why we know that there's a lot of asymptomatic transmission in the community. However, so we could see a spike within the next week or two. Usually, people after they develop symptoms of COVID-19, it takes several days, usually 3 to 5 days before they develop a severe illness that they would require evaluation in an emergency department and an admission to the hospital. So time will tell, and we just really have to hope that there was nobody in that group that was infected with COVID-19 and transmitted to other people.
Thank you. Next question, Mike Baggerman, WBEN.
Hi, Mark. You had mentioned that there is no intent for you to have a curfew tonight, but obviously, as you had mentioned, there's a protest that's starting just now in downtown Buffalo. What factors would go into you declaring a curfew tonight if, say you do change your mind?
Well, the protest in itself is not going to be a factor. I mean, we've seen peaceful protests in Buffalo forever, and there's always protests going on in downtown Buffalo, including Niagara Square. If we actually saw looting and rioting, then we might consider a curfew, and depending on where the incidents appear to be, whether it be countywide or limited. We don't have any indication, like we did the last few days with prior intelligence, of there being potential issues in locations, whether it's the city of Buffalo or elsewhere. As I noted yesterday afternoon when I reinstituted the curfew, that we had intelligence that there were going to be attempts to hit suburban areas. We talked last night about the social media aspect and how people were spreading rumors on social media, and people were very scared about what was going on, which was really not much, to the point that the mayor and I, when we had our press conference last night, we noted the incidences that we were aware of, but we also shot down, so to speak, a lot of the social media rumors that were out there. People were scared, I guess rightly so. I understand why. And I thought it was important that we also spread out the information, that a lot of the information was misinformation. And so we're going to get out to the public accurate information. I have no reason to believe at this point that we would be in a situation where we could potentially have looting and rioting again tonight. If it existed, if it happened, then yeah, I would consider putting a curfew back in place, and then we'd have to determine if it would be limited or not. But right now, I have no information to indicate that that is the case tonight, and I'm hoping that the protest that is starting right now in Niagara Square, no matter what size it is a peaceful protest. And a peaceful protest can be peaceful, but also can have a little screaming and yelling. That's okay. It's when it gets to the violent actions and when there's fights and when there's looting and other types of violence that it's no longer a peaceful protest. The First Amendment of the Constitution protects the right of people to peaceably assemble. And peaceably assemble and to issue a grievance against their government is one of the most fundamental rights we have as Americans. When it goes beyond that, when it engages in destruction of property, physical violence between individuals, it's no longer a peaceful protest. And at that time, if we got that, then I would consider reinstituting a curfew, but I really don't ever want to do that again. WBFO, did anybody call in? WBLK? If not, WGRZ, Channel 2.
Hi, Mark. Thank you so much for taking our questions. My question is similar to a question from Spectrum News in regards to fear about a spike in coronavirus cases due to the recent protests. Obviously, Western New York has been working pretty hard with social distancing to try and progress through the phases set up by Governor Cuomo. Are there major concerns right now with so many people gathering for these protests that it could set the Western New York region back?
It is a concern. It's just like we had a concern when there were the protests regarding opening up New York State. We certainly are concerned about any individuals that are not practicing social distancing. I think the one thing we did see from that protest, at least early on, especially when the vast majority of the people were there, is they were wearing masks. So that's a good sign. But we would not have an indication of spread in the community as a result of the protest for some time now. I don't think it will affect us with regards to phase 2 tomorrow. which once again, I'm crossing the fingers. I think we're going to open tomorrow, but we're going to get the final word on that in the next few hours from New York State. Yeah, it could have an issue in the future, especially as we're thinking about going into phase 3. We're just going to have to keep track of it, and that's why we want to test people. The more people we test, including those that attended the protest, and if they come back negative, okay, we're fine. If we start to see increases in the positivity rate with regards to the tests that we're doing, especially those who attended the protest, then it would indicate to me that individuals were at the protest with coronavirus and it spread it to others. Let's hope that doesn't happen. WIVB TV.
Hi, Mark. Couple questions here. You mentioned, and the doctor also, that you would like to see barbers and hairstylists getting a diagnostic COVID test every 2 weeks. I'm wondering if that's a recommendation or if that's mandatory, and then why you're kind of singling those folks out and not, every business person opening in phase 2.
That is mandatory pursuant to the guidelines that were created by New York State. We don't have any say in that. It is the same whether there's somebody in Erie County, Niagara County, or for that matter, Monroe County, Albany County, Onondaga County, Westchester. Those are the standards that New York State has put in place. They believe that the barbers and stylists are more at risk for catching it because of the number of individuals that come from across the community for work and the closeness that they have. There are, of course, significant restrictions put in place for those in the healthcare field, and they feel that this is the best way to protect barbers and stylists and, as a result, the general public. This is not a recommendation from Erie County. This is something that is required by New York State. WKBW TV, and did anyone come on?
Hi, Mark. Yeah, Ashley Rowe here.
Hi, Ashley.
A recent study from Canada showed that the majority of Canadians think that the border ban should extend beyond June 21st, when it's currently set to reopen. What's your take? Do you think that the border should remain closed to non-essential traffic well into the summer?
It is a concern. We certainly have seen essential traffic with regards to business crossing the Peace Bridge, which is very important, as well as the other bridges in the area, the Niagara, the Lewiston-Queenston Bridge, the Whirlpool Bridge, the one right in downtown Niagara Falls. I'm very happy that we have had business traffic. I know there's a lot of people who have cottages, summer homes in Ontario that live in New York who have not been able to access them. I think once again we have to remember that we're still in a global pandemic. While the numbers are getting better, we are in a pandemic. I think Canadians truthfully are worried about transmission of coronavirus into Canada. If you look at New York State and make comparisons of New York State compared to countries in the world, New York State is worse, and I was not happy about the numbers we had in Erie County. We are worse than some of our peer groups, including communities that are larger, and we've talked about that in past with regards to Allegheny County, Pennsylvania, where Pittsburgh is, or Cuyahoga County, Cleveland, or Cuyahoga County, Ohio, where Cleveland is. And I know the Canadians are fearful that they're going to have transmission if we allow complete cross-border traffic to go. I would be hopeful that they would open on June 21st, especially as our numbers decrease. If we continue on the trend that we are in here in this region, and good numbers continue, we will actually be, in all likelihood, in phase 3 by June 21st. So I'm hopeful that the Canadian government sticks with the June 21st. If they didn't, at least I understand why.
Thank you.
You're welcome. Any others that I did not mention? If not, going back up to the top, Buffalo News, do you have any other additional questions? Aaron and Sandy? Okay. Spectrum Buffalo, any more questions?
Yeah, one more question.
Sure.
One more question. Sorry. This one's for Dr. Burstein. If we do see a second wave coming out of all of this, people not following social distancing recently, are all of our contact tracers prepared for this? Is there any chance that we could get overwhelmed?
Well, there's always a chance. However, our contact tracers are doing a great job They're very efficient. They've been doing it for a while, and we have, the cavalry has come to relieve us. We have, as you've seen, a large number of contact tracers, and we're getting to our contacts. We're getting to our cases. We're investigating those cases. We're identifying their contacts and notifying their contacts. So that work is getting done. And if we have more cases and more investigations to conduct, we do have a surge that we can assign to do that work. So this is vital work. This is bread and butter work of epidemiology, and this is what we do for any type of disease outbreak. And so this is what we're doing. We've done it before, and we're doing it again, just at a larger scale, and we are prepared.
Thank you. Mike Baggerman, WBEN, any other questions?
Yes, just to kind of follow up on some of the earlier questions that were asked, but to look at it a different way, even though we had all of these riots over the weekend and all the protests where hundreds of people gathered, if the data finds that we're not seeing a lot of new coronavirus hospitalizations because of this, should that be an argument that the economy should start to open up quicker and that you guys should advocate that we try to get back to normal as soon as possible rather than waiting, say, 2 weeks at a time?
I think first off, we probably won't have definitive data because of the timing of the protests until we've basically reached the end of phase 2 anyway. And so that'll give us a better understanding, and it's very likely that we'll be entering phase 3 if we continue. If we don't continue on the trend we've been doing, if we start to see hospitalizations go up and we identify that these individuals attended the protest, well, then that's going to be concerning. It's just premature to say that. Yes, I think the estimates were up to 2,000 people attended the protest at its height on Saturday, and when it started to break down and became not a protest anymore, but violence, it had dropped down to approximately 500 people at that point. So I'm hopeful that the numbers will show that people did not contract it. If they did, we're going to test them. Hopefully, if they are sick, and if you're sick, you should get tested. Simple as that. And we need to know where you were. And if we find out that a few people were at the rally and they may have been sick at that point, or even if they weren't symptomatic, they were asymptomatic, well, it's going to be tough to contact trace every individual who was at the protest, but it's important that we know so that we can handle this and control it as best as we can. And I think it's just too early to say about what the results of that protest will have been. We've said all along we want people to practice safe social distancing. If you can't practice safe social distancing, make sure you wear your mask. A lot of people were wearing their masks, others weren't. And hopefully we will not see an increased numbers. If we do, we'll report that to the public. Going down
Real quick question. I'm sorry to interrupt here. Elective surgeries for hospitals. I know I asked you about this last week, but are they getting any kind of? Will they be allowed to begin again throughout all of Erie County? I know I asked you this last week, but do you know if they're getting anything here?
The medical societies have advocated. We've advocated for them opening them up. We are just waiting word from New York State. It was discussed earlier today on the control group call with the Lieutenant Governor and Dr. Jim Malatras from Empire State College. He said he was going to go back and look at it. I don't understand why now, with the drop in hospitalizations, they haven't allowed them with regards to the ambulatory care centers and Buffalo General. They should allow it, but as of right now, it's in New York State's hands. We were hoping we'd also have an answer on that by the end of the day, as well as the confirmation that, yes, we'll be entering phase 2 as of tomorrow.
And Mark, if I may add, I mean, this is really a big problem for public health, because these the hospitals and their associated ambulatory care centers and independent ambulatory care centers and endoscopy suites do a lot more than just routine elective surgery. I mean, they're doing essential cancer screening services. They're doing some eye surgery to really change the quality of life for individuals and help with their visual acuity. They're doing hip replacements, again, helping individuals, improving their quality of life. So we're really hoping to be able to expand this, and really Erie County is really one of the only counties in New York State that isn't able to do elective procedures in any site that can perform elective procedures, as long as they adhere within the guidelines for under New York State for COVID-19. And so it's it's a big struggle because I know that there are a lot of people probably walking around in Erie County with undiagnosed colon cancer, for example, or esophageal cancer, and we really like to get back to business to be able to offer Erie County residents the essential cancer screening and improvement in quality of life.
Thank you, Doctor. And endoscopy suite sounds a whole lot nicer than what actually the procedure is. So thank you for that.
Cleans you out. It's good for you.
WGRZ, any more questions? WIVB, Kelsey Anderson, any more questions?
Yeah, one quick question. I was wondering if any extra security was afforded to you, Mark, over the past few days.
Yes, there was with regards to threats that were made against public officials. So we returned to the traditional detail I had during last year when there was threats against my life. I'm hoping that I can reduce that again, but while there were threats against public officials, we decided it was best to have security than not. And
Do you know how long that security will last? Oh, I'm sorry, I didn't mean to interrupt.
I have no idea at this point. I had security last year after a threat at my house and in my life, and we decided it was best to after a while to eliminate that security, but we've had it at various points. We don't always have it, but we've had it at various points, and after the issues of the last few nights, including threats that were made on public officials' lives, it was decided that I should have 24-hour security once again, and as I've said before, if you've ever had 24-hour security, while the officers are great, you don't necessarily feel, while you feel secure, you don't necessarily feel like you have your life in your control anymore because you're always dealing with the security officers. So, and they do a great job. But if I could avoid it, I prefer. But until such time as we feel that the matter is safe for myself and my loved ones, we'll have security. And final question goes to WKBW. Ashley, do you have any other questions?
I'm all set. Thanks, Mark.
All right. Well, thank you.
Mark, it's Andy Tan with the Buffalo News. Hi, Mark. I'm sorry. It's Andy Tan. I was on mute when you called on us. If I could ask a question?
Yes, please. Go ahead.
Oh, okay. So, in regard to the governor announced that dentists, for instance, could reopen offices. Are there any other groups of people, or services, or businesses that you've been in touch with the governor's office that might be allowed to open in between phases? That you've heard about, anything that they're discussing?
No.
Okay. And also, is there any, what would you say is the biggest takeaway that you want people to have as we look ahead to the phase 2 reopening? I mean, if there's one message you really think people need to know, I know lots of people are very excited and happy to see that we are moving forward again to the path to reopening. Is there anything that you think is a take-home message that you want to leave with them?
I think the biggest message would be just because we're moving in phase 2 doesn't mean that everything is exactly as it was before. Restaurants and bars will still be closed. They're phase 3. Sporting activity will still be closed. And when it comes to going around in our community, you still have to wear a mask if you cannot practice safe social distancing. And we're hoping that the information that we get from individuals who are in the phase 2 businesses that open, especially those in the office setting, is that they follow safe social distancing and their safety plans. If they don't, and coronavirus spreads, we could go backwards. None of us want to go backwards. We want to keep on moving forward so that we get through phase 2, and then we're into phase 3, and then finally phase 4, and hopefully we are over this at least for the time being. We know there's a possibility of return in the fall, based on what you've seen from prior viruses and infections. However, if we continue to follow safe social distancing guidelines to protect ourselves and to protect other people, we'll all be better for it. I wear a mask not only to protect myself, but primarily to protect you from anything I may have, and I need you to do the same thing because we're all our brothers and sisters' keeper. Which leads to closing, as Dr. King noted, the best way to move forward to address injustice in our society, especially racial injustice, is not to engage in violent activity, but to do it through nonviolent motives. So the protest has started. It's a small protest, I've already been told, in Buffalo today, and I hope those individuals understand, and I know they probably do, that the best way to get their message across is by showing the general public They're disgust with what they see, but not to engage in violence. That's where you lose the vast majority of the public, because I believe the vast majority of the public is disgusted on what they saw in Minneapolis, and that also includes law enforcement officers. So if we're to move forward as a community, let's do it together, let's do it in a peaceful manner, and then let's work together to eliminate these racial injustices, and we will be a better community for it. Thank you.